I can imagine at this point, like initially when with your diagnosis, like you and Google were best friends in terms
Uh-huh.
of research and approach and finding contacts, but also I guess in terms of that there's other platforms out there in terms of communication. And I'm saying this in a long-winded way to say in terms of platforms which are ideal for someone that's going through this disease. What would you say is an ideal platform, and how should the platform be leveraged to communicate with someone such that they need to come in for a dentist appointment?
Gosh. Well, I would definitely say Google, because we all are on Dr. Google, and and if
Dr. Google.
Google, yeah, in this case, Dr. Dentist Google, is that it would probably be something they could add in, however, SEO or keywords about cancer care, oral cancer care or something like that, so that people would know that they can acknowledge that. And then the other thing, I think maybe it would be helpful to have, we're all fascinated with social media, Instagram, TikTok, all the things. So, I mean, just keep talking about it. Maybe some dentists could do like a little quick Instagram thing. Say, hey, did you know that you're supposed to come see me before have you been recently diagnosed? There's even if they've been diagnosed, even if they've started treatment, it doesn't mean they can't be seen. They just have to make sure that they're walking with the doctor to be really careful. So it's important, to know that there's dentists out there that want to do that journey and have some experience with it. And I think the more that you get that warm fuzzy from them is wonderful, right? And unfortunately, that's how we learn a lot of things anymore. Instead of directly from our doctors, we learn it online. So I think just putting more presence out there in social media and put it in their keywords. And is it keywords, Edward? You're the Google king.
Yeah, yes, yeah. We use so there's a couple. Yeah, we use keywords.
Yeah,
So the artificial empire, right? Blog posts,
yeah, all that.
stuff like that. Yes.
Yeah. So I think that would be really helpful, but I don't think it's talked about. So dentists that decide to start talking about it, I think it would be fantastic.
Okay, so it's not a taboo topic.
No,
Yeah.
no, I think it would be very, very helpful, because then people might want to start asking questions. They may have concerns that they didn't bring up or not realize that, all the detriments that happen with, I mean, chemo is like, it's the beast. One of the ones I had was called the Red Devil. That should give you enough of
Wow.
a name to just tell you. So just imagine what it does to your whole body as it's fighting. But that you can have a lot of things happen from teeth and loose teeth and gums and all that. And so what a great thing to have a dentist that's going to help you get healthier afterwards and get your mouth in better health. Because the quicker you do it, I feel like the quicker it can be salvaged and really get back to a good healthy spot.
That's a lot of things. Yes.
Sorry.
This is not medical advice for those of you guys out there. This is just her experience. Yeah, it's Dr. Google. Yes, Dr. Google. Google.
Oh, sorry. I know. Get on the roll.
No, it's great information. So, like in terms of your journey with like your oral health and taking care of that, did you get the majority of your information from your care provider? Like, did you were you lucky and blessed to have that as part of your package, or did you happen to stumble upon some content online and was like, wow, maybe I should look into this? Or did you have to see the dentist any more frequently or less frequently as a result of the treatment or the ongoing treatment?
More frequently. And also, I didn't know that there were dentists that were very familiar with the care afterwards. I actually did experience one that did not have experience with it, and so I ended up going somewhere else, and that was fine. And by doing that, though, then I was on a much better care plan. And yes, I had to go more frequently at first. I'm at that 5-year mark, so I'm in a lot better place. But I had to go a lot more frequently. I still have It's certainly not the same as they were before, but I'm certainly glad to have regained a lot of health and that kind of thing because of going.